I want to show you who we are today. So this is me. I'm sharing this session. My name is Ada Garcia, and I am a senior lecturer in public health nutrition here at the University of Glasgow. And I am part of SCAF, so in Theme 4, which is about food insecurity communities. And today we have the pleasure to welcome Emma Hunter from Robert Gordon University, Emma Smith, who works with Glasgow City Health Social Care Partnership, as well as Dominic Harvey, who also works in Glasgow City Health Social Care Partnership. So maybe we can just do a very brief introduction. So Emma, can you introduce yourself?
Yeah, hi, thank you. So yeah, I'm Emma Hunter. I'm a research fellow at Robert Gordon University, as you mentioned, in Aberdeen. Currently working on the DIO-Food project, which is Dietary and Health Inequalities project. So that's what I'm going to talk about more today. Yeah, really happy to be invited. Thank you.
Thank you. Emma Smith?
Hello everybody, my name is Emma Smith. I'm one of the Children's Services Managers in Glasgow City HSCP. I manage the health visiting service in the northwest of Glasgow and also cover school nursing for Glasgow City as well.
Dominic, thank you for joining us.
Hi everyone, I'm Dominic Harvey, Head of Planning for Children's Services and also Northeast Locality within Glasgow Health and Social Care Partnership, and I'm standing in for Mike Burns today.
Thank you very much for doing that. So just before we start, I want to very briefly mention to everyone who is joining us today about SCAF, the Scottish Alliance for Food, and what this is about. So this is a group of academics and people coming from different backgrounds, not just academia, who are working together to try and address the complexity of the issues related to the food system. And this is with the purpose of formulating research related activities and also trying to find out how to solve this very complicated issue of making our food system a much better one. We want to have improvements in health sustainability, but also equity. And we do these through different actions. So these are some of the things that happen in SCAF. So we have 4 different themes, all related to the food, health, equity, and sustainability. So aspects of food. So we have mapping, innovation, the theme of food security and communities that I am working here today in this webinar. And we also have culture, so food-related culture, and there are work streams through these different themes that are to do with also having an academy of citizens. There are different things that happen in SCAF. So you can see here mapping priorities. One of the things that we're doing today, bringing science and also activities related to food through webinars and workshops. We have many other things going on. We want people to be part of this effort to improve the food system, connecting different people, stakeholders, having conversations about food. We want to find ways to mobilize knowledge and also through writing and doing activities to bring ideas about research. We want to have a more collaborative approach to research. And there is also some support on doing research. And if you want to learn more, there is a web link here, but also you can go to our SCAF website. Okay, so with that, I'm going to introduce the first speaker. So, sorry, this is for later on. So please, Emma, if you want to share your slides.
If I do drop out sound or the slides don't change, do let me know. So yeah, as I already said, I'm Emma. I'm a researcher at Robert Gordon University in Aberdeen, and today I'm going to talk about the DIO-Food, or the Diet and Health Inequalities project, that I've been involved in. So I should just very briefly mention that DioFood has 3 interrelated work packages. So these focus at the early years, people living on a low income, and also in the retail context to generate evidence-based research and commentary that informs diet-related health inequalities policy and practice. So although there are another 2 work packages as part of DioFood, I'm going to focus today solely on the work conducted by myself and Professor Flora Douglas as part of work package 5. So just to give a little bit of background on this study, so maternal and infant food insecurity is poorly characterised and understood in the UK. But we do know that the first 1001 days is a critical period in child development that has lifelong impacts on health and well-being. And at this stage, good nutrition is really essential. So the UNICEF guidelines state that for infants aged 0 to 6 months, exclusive breastfeeding without any additional food or fluids, not even water, is recommended. So we do know that breastfeeding can be challenging though, and for families who choose to bottle feed, infant formula, as you probably heard on the news, is very, very expensive. So formula is not often provided by food banks due to UNICEF guidelines, and formula milk, unfortunately, has been reported as one of the most shoplifted items from retail and pharmacy stores. So while efforts have been made to monitor household and childhood food insecurity and secure the right to food for children in the UK through policy development, there's still a lack of research on maternal and infant food insecurity in the UK, especially around very young infants. So the aim of the DioFood project, or work package 5 of the DioFood project, is to capture parents and carers' lived experiences and explore influences that they feel impact or impacted infant feeding associated with the current cost of living crisis. So we're aiming to achieve this through the following objectives. So objective 1, investigate food and feeding related challenges parents and families have experienced during the first 6 months of their infants' lives. Objective 2, explore parents or carers' experiences of realising or maybe not realising their feeding intentions during their infant's first 6 months. And objective 3, investigate parents and carers' perceptions of factors that help or hinder their infant feeding experiences. So we are still recruiting to this study until the end of this month. We've been looking to speak with parents and carers responsible for feeding a baby aged 0 to 6 months, born any time since 2022. We're looking to speak to parents and carers who self-report as being food insecure. So that could be reporting worrying about running out of food or actually running out of food and not having money to buy more. Parents and carers need to be aged 18 and over, and online participants need to be willing to turn on their camera. And this was added following an attempt to recruit using social media. So unfortunately, we met with some participants that we felt didn't have the relevant lived experience we were looking for. And one thing neither of these participants said they were willing or able to do was to turn on their camera. So we added that as an inclusion criteria. And because of the issues around recruiting through social media, we decided to focus our recruitment on moving through trusted organisations and networks. So we reached out to third sector and government organisations in Scotland and England, community centres around the Aberdeen and Aberdeenshire area. And these included going to PEEP groups, which are free groups run for parents and children. They're run by Aberdeen City Council. And we also have an advisory group working with us throughout the DioFood project. So we looked at our advisory group members for help with recruitment, and we also spoke to colleagues. So far, we've spoken with 11 participants, and today I'm going to present the results from data analysis that's been conducted so far on 9 interviews. So the next slides highlight some of our preliminary findings. So it's important to note that the findings may change as our analysis of the data continues. So just to give you a little bit of information on our 9 participants, we have 8 mums and 1 dad. We have 4 single parent families, 4 families of 3, so 2 parents and 1 child, and 1 family of 4, so 2 parents and 2 children. When I spoke to the parents, their babies were aged between 9 weeks and 2 years, but we always asked participants to focus on their experience during their baby's first 6 months. We had the majority of participants lived in Aberdeen. There were 2 in Aberdeenshire and 1 in Inverclyde. In terms of feeding intentions, so the majority intended to breastfeed, but most of them then ended up moving to bottle feed for reasons including a lack of support and anxiety around milk production and their baby not getting sufficient milk, although this wasn't stated as being related to food insecurity of the parent. So in relation to objective 1, so this looks at the feeding related challenges parents and families have experienced during their infant's first 6 months. There was this notion around sort of don't ask, don't tell. So this sort of emerged surrounding conversations with health professionals, where participants shared there was no discussion around new parents' financial circumstances. So participant 2 shared, they never asked that. So this was around their ability to afford formula for their baby. And in this case, it was dairy-free formula, which is more expensive. So she goes on to say, but even if, let's say they had asked, I don't think, well, what would they suggest? So she seemed to think there was really nothing that health professionals could do. And she also maybe then goes to speak about, to receive support, you need to kind of be financially destitute. And there's a stigma around that. It wouldn't be a regular payment. So there was a little uncertainty about what health professionals could do. Participant 3, this was our dad. So he talked about it being more focused on finding solutions to problems. So if a baby has reflux, you can use Gaviscon, but they don't share how expensive anything like this might be, which he felt were the kind of the key pieces of information that new parents really want to know. Sticking with food and feeding related challenges, there was a sense of strained conversations around infant formula, with participants reporting conversations around formula being shut down, or health visitors stating they were not allowed to speak about formula or advocate for certain products. And this gives a sense that, open, honest discussions around feeding experiences and challenges then became quite difficult for new parents. So potentially due to a lack of conversations with health professionals, participants then described a journey of trial and error when finding suitable formula. So participant 1 here describes moving from Aldi's own brand milk to Cow & Gate to SMA comfort formula to SMA soya formula. So just starting with the cheapest and then kind of moving upwards. And then parents also described obtaining information on suitable formula through unregulated online sources. So, YouTube, TikTok, Facebook, those kinds of social media sites as well. So participants' experiences of bottle feeding highlighted the struggle due to the high cost of formula, especially for infants with intolerances. So like participant 3 says, they needed to give their baby anti-reflux formula. So a normal tub is £10, the reflux one is £14. And he comments, you just feel like you're getting punished for something you can't help. Participants often displayed an in-depth knowledge of formula prices across multiple retailers, as demonstrated by the quote by participant 7. So, they're always trying to find the cheapest formula. They talk about, asking a friend to pick some up from Costco, and then they've discovered, an Asda it's £13.50 for 800 grams, where it's, you can get a 1.2 kilo bag in Sainsbury's for £16. And then they also know exactly kind of how long that's going to last. So there's a lot of work going into finding formula and a real in-depth knowledge about the high costs involved. There were challenges around breastfeeding. Participants did acknowledge the benefits, but they also encountered challenges. So the perceived benefits of breastfeeding included, the health of the baby, the bonding experience, the health of the mother, the ease, there's less of a faff than formula, it's free, it's the right temperature, these kind of benefits. But despite this, many did move to bottle feed. And again, they talk to the challenges around breastfeeding. So participant 6 says, I tried in hospital and I started getting really anxious really quickly that she wasn't getting enough. She tried pumping and there was, nothing happened. And then she went to this downward spiral of thinking, I need to formula feed and it's just easier. But even in participants who did go on to continue breastfeeding, there were still challenges. So participant 7, she was a breastfeeding mum, but she said it's not actually coming so easy for everyone. A few times a day I would sit in the bathroom and I'd be crying because I can't feed her and she's screaming and I don't know what to do. So there was a sense of, around sort of perceptions of factors that help or hinder infant feeding experience, it became apparent families were experiencing shortfall struggles, where they were finding they had increased outgoings, more mouths to feed, which were not covered by benefits, and then maybe the drop in maternity pay, like from being on full pay, just didn't cover their outgoings. So like participant 1, she talks to being on universal credit, and once she's paid her bill, she's still having to use the food bank to get food for herself. And then the Best Start food card, just not, really, she's getting 2 or 3 tubs of formula a month. Then she has to go on to rely on friends and family to help her with whatever else she needs. And participant 2 talks to, the drop in pay, moving to maternity pay, and saying, she thinks it's criminal that they expect people to be able to feed a new person, but then pay you way less than you would normally be getting. And as I've already kind of mentioned, these shortfall struggles that families face, the shortfalls are often picked up by family, and participants talked about various family members helping them to acquire formula, food shopping, or provide financial monetary assistance. And also third sector organisations were often described as a lifeline when parents were struggling. So providing money to access formula. So participant 3 talks about CFINE providing some formula funding which led them to be able to get 4 tubs of formula, or providing equipment to help with feeding. So like participant 1 talks about, she found some bottles, she managed to find ones her son liked, and she got them in a charity shop, but she couldn't afford to buy any more because they were quite expensive. So then she contacted Aber Necessities, and she said they rocked up at my door with 10 bottles and saved the day. So we did ask participants, what they thought might be useful to help support families living on a low income. So at the upstream government level, the suggestions included easier access to formula for those on low incomes. So maybe a system similar to arranging a prescription from your GP or obtaining medicine from the chemist. They also suggested potentially free formula for those in receipt of benefits. There was also suggestions around like the introduction of a cap on what supermarkets can charge for infant formula. And then also a review into statutory maternity pay and the rates that people receive. At the more local or community level, participants suggested advice on meals made with low-cost ingredients, so things like you might get in a wonky fruit and veg box from Lidl, and realistic budgeting information, so information around the cost of everything you need to care for a baby, but focusing on what you really need rather than all the kind of extras that you're trying to, or if that come with having a baby, the things just focusing on what parents really truly need. So far, the results suggest that healthcare professionals avoid sometimes or have strained conversations with new parents around finances and formula feeding. This potentially creates a missed opportunity to ensure that new parents and infants have all the support that they are entitled to. It can lead parents to embark on unnecessarily lengthy and costly journeys of trial and error to find suitable formulas, and potentially information seeking from unregulated sources. In terms of parents' experiences of realising their feeding intentions, the majority did intend to breastfeed, perceiving it as beneficial for health, bonding and ease. However, participant experiences show that it doesn't always come easy and it's challenging for many. Income, including benefits and maternity pay, often don't cover outgoings, and families in the third sector organisations often cover financial shortfalls experienced by new parents and help them to acquire food, formula, nappies and essentials. And parents would welcome both government level and community level intervention to help those struggling to feed themselves and their families. And again, it is just really important to highlight these are preliminary findings, and our data analysis does continue. But thank you so much for listening.
Thanks very much, Emma. So we will leave all the questions for the end. So please keep your questions, and you can also put them in the chat. And then we will come back to the discussion at the end, okay? So now I will welcome, so Emma, will you like to share your slides, please?
Thank you. I'm just going to hand over to Dominic just in a second. Just really welcome the opportunity to be here with you today. Hopefully we'll pick up some of the discussion. It's been brilliant to hear that previous presentation there, Emma, from the voice of parents and what matters. So hopefully we're able to share a little bit about some conversations we've had with parents in Glasgow City, HSCP, and how we're managing that gap when infant food insecurity is such an issue. So I'm going to hand over to Dominic just now.
Thanks, Emma. So just to kick off with then, we've been on a bit of a journey in Glasgow over the last 8 years, really, to think about how we shift the balance of care to achieve better outcomes for children and their families. And this really aligns, as many of you are aware of, with the policy framework in Scotland, which directs us to focus very much on prevention and early intervention and to avoid exacerbating the failure demand that was described by the Christie Commission. And recent work in Glasgow has estimated that the cost of supporting children impacted by poverty in the city alone is between about 800 million and 1.09 billion. And that's really prompted us to consider what we could achieve if some of that resource was channeled into more prevention work. So, as well as aligned policy, considering the impact of policy in poverty, which we really welcome in terms of the emphasis in the promise and other areas of our policy landscape. We're really clear in the city that families are our most important infrastructure. It's not the roads, it's not the avenues project, it's absolutely supporting families to stay together and to be with brothers and sisters. So thinking about some of the local drivers in the city, an analysis was carried out by Paul Bywaters back in 2015, and he was comparing, some of you will be aware of the study, the 4 areas of the UK, and our figures for Glasgow are in green in that graph. And what his work showed was that children from the most deprived 20% of neighbourhoods are overrepresented in rates of accommodation. And again, that led us to think, how much are we considering and responding to the impact of poverty and the children we're supporting within our social work system? Thanks, Emma. Around the same time as Paul Bywaters and his colleagues was undertaking that work, we were really digging in to understand some of our own data within the system. So that pie chart there represents an analysis of the £166 million budget for children's services in the city. And what you can see there is a disproportionate spend on quite a small cohort of young people. And in fact, out of that £95 million, we realised at that time that we were spending £42 million on 239 children in placement. And that really led us to question, firstly, what would the children in those placements think in terms of the value of the investment in them? And what would it look like if we gave this money directly back to families? At the same time, we were conscious that a high number of children and young people were living out with the city. So they're in placements all over Scotland and elsewhere, disconnected from their families, their peers, their communities. We also felt there was a lack of good outcomes around the spend in these placements. So we couldn't really say that we could, hand in heart, say that that spend was good value for the young people in the placements. And at the same time, national research encouraged us to look locally, and we found that 2/3 of our young people were choosing to return to live with their families after the placement ended. And that was a real surprise within the system. And I suppose all of that really told us what we need to do is going back to family and think about how do we support and invest in families. At the same time, we have been working through a number of challenges that I don't think are unique to Glasgow. So particularly in the current context, funding shortfalls that everyone is experiencing. In some areas, some fragmented policy and funding streams. We were also conscious of the complex system for families to navigate who need support. And I think we heard a little bit of that coming out in the research in the first presentation. And that referring on, creating some delays for families. We realised that within our system, we're sometimes actually employing connector roles to navigate the system for families. And we really felt that I suppose the number of ways that families can come into the system is also a confusing landscape. Thanks, Emma. So in thinking a bit about how we shifted the system to think about how we move from that identity risk to actually purposefully trying to design our services to support families to care and protect for their own children. And there's been a lot of work, I'll not go into the detail of this diagram, but there's been a lot of work to really think how we quite intentionally create that shift and also create the permissions for practitioners to hold risk in a different way and to work with families in a different way. And some of that work has very much been about seeing families as experts in their own lives. And that work has really allowed us to, I suppose, build on our anti-poverty approaches in the city, which Emma's going to talk a wee bit about. Thanks, Emma. And some of the work that was going on with the Child's Welfare Inequalities study that I referenced earlier was very much recognising that some of the shift that we've been able to achieve, which we're also going to go on and show you later in the presentation, has been about the recognition that services were focused far too much on moving from risk to removal rather than on reducing risk by maintaining those existing relationships. And I think that's been absolutely key to some of the work we've been doing. Across some of the services that are outlined in that diagram are some of those that we really think are demonstrating that strengths-based approach with families. And these are some of the kind of emerging practices that we're really trying to build and think about how we scale within the system. So that shifting power and control to families, really thinking about families' preferences, their priorities, and as I said, them being experts in their own lives, reorienting systems very much towards that strengths-based and flexible family support focus, towards communities and neighbourhoods, and away from that risk-focused paradigm, towards more identifying and building family assets. And we're really looking at that within the whole family wellbeing work in Glasgow that we're developing. We're trying to move away from that formal professional distance towards much more informal and nurturing approaches. And again, the work Emma's going to go on to talk about very much captures that. And we're thinking about long-lasting relational practice, keeping the promise, as well as capacity building. So investing in staff, holding the hands of those who hold the hands of family, as described in the promise, and really thinking about the skills and capacity of parents and carers to care for their own children. And I'll pass you over to Emma now to talk a little bit about the work she's been doing.
Thanks very much, Dominic. I'm hoping that section 22 here is a bit of an example just about thinking about infant food insecurity directly, and actually what we'll be able to achieve in Glasgow. So I'm going to be able to tell you a wee bit about that just now. So just capturing what Emma's presentation said as well, if families are destitute currently previously in Glasgow City HSCP, that would have been a direct referral through to social work to ask for a destitution payment. Health visitors and family nurses that I work with in Glasgow City discussed their concerns that if families are experiencing extreme and financial hardship, that resulted in an inappropriate referral to social work for the access to short-term financial support. And really the stigma around that, when families have been brave enough to either raise an issue but not been able to particularly afford to buy formula, that would then result in a referral to social work. It didn't seem right for us, it didn't seem morally correct, and it definitely didn't seem supportive to families. Just a bit of background on what section 22 is. So section 22 of the Children Scotland Act sets out the local authorities' duty to safeguard and promote the welfare of children. And previously, as I say, section 22 payments were only authorised by social workers. However, in Glasgow City, following a proposal to our integrated joint board and through our heads of service, it was agreed that health visitors and family nurses and now school nurses can have access directly to section 22 payments for families whenever they need it. We're able to make an immediate payment on the same day for families up to £40, and with the discretion with service managers up to £100 when that's needed for families. That means that we don't then record in the social work system that families are open to social work in any way. It's that early intervention support for families when they need it on the same day. And again, that ties into what Dominic's been talking about there in terms of that transformational approach to work with families, keeping families together and supporting anti-poverty. So the eligibility criteria for section 22 payments are that a family is unable to provide heating or food. The family are unable to afford transport costs to health appointments, so we can support with that, or any other supports considered to be unable to be managed by our social work colleagues as well. So referral to social work is otherwise not required at that particular moment in time. There's a strict governance around Section 22, as you would imagine. So we have a review of payment history, not only by family, but in terms of locality spend and right across the city. That's reviewed initially by our health visitor team leaders and our family nurse supervisors, but also in terms of our service manager responsibilities and heads of service in terms of the overall spend. We don't have a cap on how many Section 22 payments are made for families. So it can be a repeated payment, and families don't need to provide any additional detail around that in terms of what they need. It's just that open conversation built in that trusting relationship with their health visitor and their family nurse. What we have learned so far about Section 22 payments is that in the main, the payments are used for baby food, which again ties in with the information that Emma was sharing there with us, and mainly in particular for infant formula and for nappies. Over 80% of the respondents who have had a Section 22 payment in Glasgow City have told us that the first person they had spoken to was their health visitor or their family nurse about money. And I think it's really important to share that we have, before Section 22 was implemented, is that we had a particular training package for all health visitors and family nurses to make sure that we were raising financial inquiry at every single contact with families, so that families realise that this was something that we could help them with. And I think if we don't have that at the crux of what we do, families find it difficult to speak to us about money concerns in particular. We speak about Section 22 in terms of our support with third sector colleagues as well as food banks, and also with our colleagues in social work, so that they know that health visitors, family nurses and now school nurses can access that immediate payment for families on the same day. So far, we've made a total of 276 payments in Glasgow City, and 10% of those families are now receiving repeat payments. Families receiving payments live across the city, but however, mainly in the SIMD 1 and 2 areas in particular. We recently completed a survey with families and with health visitors themselves, and some of the feedback from families around the difference that this payment has made is families' voice have said here that they would have been stranded and helpless if that payment wasn't available to them. We would have had nothing, we'd had to go back to the food bank. I wouldn't have been able to provide food for my children, is some of the feedback that we've had directly from families. We also asked about the relationship and the impact of the health visitor relationship with the fact that we could make this payment straight away for families. And again, the majority of families have said that they feel that it's improved their relationship with their health visitor. They feel the ability that they can trust their health visitor, and they know it's something that we can help with, as long with family nurses as well, I should say. Pass back to Dominique. Thank you.
Okay, thanks, Emma. So in terms of addressing poverty, and obviously the Promise Plan sets out there must be significant ongoing and persistent commitment to this. What have we been doing then in the city? So we've very much been guided by our learning throughout the pandemic, and reflecting on some of the flexibility that we had around about our funding at that time. So we were given some winter social pressure funds and made the decision that we would put that out to families in the form of £400 payments with no criteria, no referral process, just an automatic payment. And in that time, we were recognising that around about January is a time of real pressure for families. Historically, we've seen up to 12 accommodations in the month of January, particularly from the point that we started this transformational journey. And after that £400 went out in January 2021, we'd won accommodation of a young person. Now, we can't say that those things are correlated, and we know that, but it did beg the question of to what extent did that help relieve pressure in families at that time. We also, around the same time, really reframed our approach, and instead of working with families to put in the services that we have, we reframed our approach to say, what can we do to help you right now, today? What do you need from us? So it wasn't about a service offer, it was much about meeting the families where they were at. We increased our kinship care budget quite significantly, so we're now spending over £11 million a year on supporting our young people in kinship. And obviously with the whole Family Wellbeing Fund, Child Poverty Pathfinder, No One Left Behind funding, and our most recent local outcome improvement plan, we've got a commitment to see poverty as our common enemy in the city, and that's borne out by the Verity House Agreement and also the Council's Grand Challenge. So we've got a lot of support from elected members and right across the system, which creates permissions at all levels of the system to work with families in a different way. We've been thinking about how we support families through the cost of living crisis in a respectful and dignified way, around about how we have that conversation. We recognise that the cost of care is becoming unaffordable, and we've seen some of the learning in it from England. And I suppose some of the work we're trying to do just now with the Scottish Government is to lobby for funding flexibility so that we can meet families' needs through direct payments where that's needed. And we see that as really building families' readiness to engage in all aspects of our services. We do recognise the growing complexity of need in the city, and some of that is a result of the journey to bring children and young people back into the city. And we're certainly trying to build that infrastructure of family support. Thanks, Emma. So this just gives you an idea of, since we started out in this journey in 2016, we were accommodating 1,413 children. We're now down to, I can't see the last column, so I'm going to flick to the next slide just to remind me, 592. So that's quite a decrease, as you'll see, and that's very much because we've been building that infrastructure to support the families. This slide now gives you the number of children on the Child Protection Register, and I think that some of the themes we're talking about today, traditionally practitioners would tell us that they would be concerned that parents could be seen as neglecting their children, and we've, as I say, worked really hard through our Section 22 payments and our response to families to make it as easy as possible for families to get what they need. So just in summary, this is the last slide. So that shows you the 59% reduction in number of accommodations. In real terms, since if you compare to rates in 2016, that's 877 more children and young people living with their families as compared to the comparable rate in 2016. That's a accommodation rate now dropped to 53 children and young people out of every 10,000 living in the city, which was previously at 135. We've reduced under fives in accommodation quite significantly, so we were under 5 placed away from their families. And while that overall agenda has led to significant savings that you can see there, we actually estimate that we've prevented £70 million of spend on accommodation out of authority. That's allowed us to increase our spend in family support and prevention work. We're also working quite hard to align what we're spending through the HSCP on family support with the wider community fund that sits with the council. And all of that has allowed us to think about how we, I suppose, create a more seamless family support pathways across the city, not just for our own workforces like health visiting, but across the wider services in general. We've been doing that cost benefit analysis to really help us, I suppose, bring stakeholders in to say, how do we do this as a collective? And fundamentally what it all boils down to is that stress-based trauma-informed approach that we're really trying to create traction for and make sure that that's kind of the linchpin for all of our services across the city. Thank you.